The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Coronavirus origins have remained a mystery to scientists for the past year plus. But according to the World Health Organization's recent investigation, it came from animals. But others aren't as convinced, insisting it was released from a lab in Wuhan to wreak havoc on the world. In this week's episode, we spoke with Dr. Anna Bento, infectious disease specialist at IU School of Public Health. Our conversation is next. Joining us here in our newsroom is Dr. Anna Bento, professor at IU School of Public Health. Hello.
Hi, thanks for having me.
Well, thank you. All right, so there's, I wouldn't say a working draft of the World Health Organization is circulating about where the origins of the coronavirus came from. So would you tell me your thoughts on what is circulating so far?
Yeah, so this report was hotly awaited, as you may imagine, given some of the news that had been circulating off and on since the beginning of the pandemic. However, this report, the results so far are not surprising, at least not in the academic and scientific community. There's been a lot of research being done on the origins of SARS-CoV-2, the virus that causes COVID-19, the disease. And from the beginning, through genetic surveillance, genomic surveillance, and through case surveillance, there's been this hypothesis that the virus could potentially be coming from bats or pangolins. So the actual origin has not been absolutely established as to exactly which animal is the original reservoir. However, the viruses that are encountered in those species are closely related enough to SARS-CoV-2, the one that causes COVID-19 in humans, that the estimation seems that they do originate from wild animals related to these two that I've referenced already.
So you said bats and penguins? Is that what you said?
Pangolins.
Oh, okay. So what these two animals, what is there something that they have in common with humans that or something there that's more makes them I don't know, transmit more easily to humans? What's going on there in terms of this?
It's not so much that I have something in common with humans, but these areas where the spillover, which means that the transition from a wild animal to humans may occur, there's a huge interface between humans and these animals. So a lot of times when humans come into contact with these wild animals, there could be a transmission. So from a virus that normally is circulating in these species, and for one reason or another, and this is completely random, this virus mutates during that process such that it becomes infectious in humans. What I wanted also to let you know, which is kind of, I think, very interesting, at least from an academic point of view, is that there are these spillover events all the time, right? Because humans contact wild animals on a daily basis in several areas of the world. What happened was unfortunate that this particular virus mutated such that it became highly infectious in humans. So it's not so much that pangolins or bats have something in common as such, but of course they are still mammals like we are. And so these viruses have the potential of infecting and then becoming infectious in a human population.
That is so interesting. And I mean, I'm wondering, well, of the close contact, of course, in Wuhan in China, but also we've seen this in different coronaviruses before, where the transmission from animal to human, that's happened before. And I mean, from what I understand, maybe MERS or SARS or maybe the H1N1.
Yes, so several viruses, not just beta coronavirus, like SARS, the first one that caused an epidemic in 2003, or MERS that caused an epidemic in the Middle East mainly, but also flu, like the cases of H1N1 that you mentioned very well, even Ebola, and even measles many centuries ago was actually a virus that started in other animals and then made a spillover onto human populations. And then, of course, we know now that measles circulates pretty much everywhere. And
Right.
the other thing that I think it's very interesting to understand is that there isn't just the ability of a virus to make the spillover onto humans, but also the other way around, right? We can also have interfaces or contacts where viruses that circulate in humans can actually then spill over onto a wild animal community or a domesticated animal community and then create a problem there.
Oh, that's so interesting that you say that, because when reports came out that tigers had the coronavirus, or dogs were contracting the coronavirus, and they were saying it wasn't species to species, it was humans, it was
That's correct.
human to canine, or that's so
That's right.
interesting. It works both ways.
That's right. So the animals that perhaps have the most potential to have in the domesticated sense, of course. So cats or cat-like animals like tigers, as you mentioned, seem to be more likely to have population spread. So imagine a cat transmitting to another cat. We have not seen that in dogs and dog communities as such, right? What we also do not see so far, at least not documented, is a transmission from, for instance, from a pet, from a cat to a human, or from a dog to a human. But there's been some evidence that we can actually cause an infection onto our pets, but it doesn't seem to transmit onwards, which is a very important point, because we also want to make sure that people don't start, getting rid of their pets just because they're panicking.
Right. Well, that's so interesting, because it seems like it would be a bi-directional arrow, but it's not. I mean, how do we know? That's
So a lot of those things are done through two different types of surveillance. So there's the genomic surveillance, where you are able to understand if a human is infected, they get tested, they get a sample, and they then sequence the virus. So then we have a time series. We have a bunch of data collected over time of when these people got infected, when they started their symptoms, and then you can construct a timeline of the likely day where they become infected. And we can do the same with animals, right? So then we can start establishing this timeline of who infected whom. And that actually is the basis for the contact tracing that is done in a lot of populations, where we start reconstructing as if it was a true crime type of series, where we try to understand through the timeline who might infected whom.
That's so interesting, that the way in which that's done. I mean, and I'm just wondering also, what would you say to people who are completely convinced that this was created in a lab, and it was possibly, because there's mixed reactions. I'm not sure. I mean, it's looking like the report will be this was, transmitted from an animal and then to humans in the way which you're explaining, but to people that this was created in a lab, and they are just so certain that this is what
Yeah.
happened.
So
Is that even possible? I don't know. I don't even know. So
there are instances where perhaps a leak from a lab could potentially spill over onto a community. However, in this case, evidence is showing us through genomic surveillance, through epidemiological surveillance. So what I mean by this is all of the samples taken in Wuhan from the beginning of the epidemic and all over the world have shown that the diversity of the virus is such that we can estimate that the likely timeline after on which the spillover from animals to humans occurred was between mid-November and early December. So that's one part. The second part of, is this likely that occurred from a lab leak? That is less likely given the genomic surveillance that has been done on the wildlife of those areas, and understanding how closely related SARS-CoV-2, the virus that causes COVID-19, is to other viruses that are now circulating in wild populations of other animals, other mammals, in that same area. So the closeness of these species leads us to conclude that is very unlikely that this was a lab-made virus, but much more likely an event of an interaction between one human or several humans at a given time that then allowed for this very quick transmission on the human population.
Do you think it was, are we talking about humans? I mean, just in the area around these bats, let's say, that contracted the virus, or were they in a specific setting? Were they testing bats? I don't know. Like,
so no, it's
okay.
in terms of how it happened.
Mm-hmm.
So a lot of times, so it's very difficult for anyone, even the scientists that actually did this investigation, to tell you exactly on what date and what event has caused it. But what we can do through analysis, phylogenomic analysis, which is this reconstruction of events through all of these sequences that have been collected from individuals who have been infected with SARS-CoV-2, is that we can kind of work our way backwards. So viruses mutate, of course, as there's transmission events. So every time there's a transmission event, there's a possibility that the virus mutates further, right? So if we work our way backwards and then compare the earliest sequence, so the earliest virus that we have encountered, and then we analyze how closely it is related with the viruses circulating in the animal population, then we can have an estimation of the timeline, like the number of mutations that might have caused it to do the jump to be infectious to humans. So hence that estimation of sometime between mid-November and sometime in December, right? So not only that estimation gives us those two things, the timeline of the spillover event, so the jump from animals to other animals, in this case us, humans, but also it gives us an estimation of how likely, and in this case is pretty much certain, that has come from other animals, in this case wild animal populations. Exactly which population and which human, right, that particular encounter, we will not know, but we can give you kind of probabilities and estimations of times.
Right. That is so interesting. And you put it in such sort of a simplified way in which we can understand how this scientific process really gives us evidence that it's, of course, we'll never know 100% sure, but let's say highest probability that given the science, this is really where this came from based on this type of genetic sequencing and transmission. And is this sort of, if we look at the history of these other coronaviruses and transmission from animal to human, was this ever contested in a way in which this might have been? I'm not familiar with all of the history, so this is the okay.
Time. And of course, you have to realize, and I'm sure you know this as well as I do, that SARS-CoV-2, so COVID-19, this pandemic, by definition, is a pandemic, so it means that it's global. Right? So when something has this global consequence, people want answers, and then sometimes a lot of answers come out through different types of questions, and some of the most exciting answers that sometimes are wrong are the ones that take off faster. Right? So it's almost this idea of a contagious process of misinformation, right? So in the case of SARS, the original SARS, so SARS-CoV-1, that occurred mostly in Asia, and MERS, which occurred mostly in the Middle East, while it was a very serious epidemic that killed many people and many people were infectious and infected, it did not have that kind of global consequence, such that perhaps people were less concerned about coming up with solutions to that problem and origins of that problem. But the process of calculating when this started, how it started, where it might originated, the process has always been the same. So genomic surveillance and epidemiological surveillance. So counting the cases, understanding when they started, and isolating these viruses to reconstruct that history of transmission.
Right. Exactly. As I like how you put it. Right. This happened in history. Like you said, not on a global scale, but the way in which these things have happened, we can sort of look to the past in the way in which the origins of this were. And I think people want, like you said, these sort of absolute answers of the one animal or the one person, we won't know. And I think it will provide some sort of answer that when this report is released.
Yes, I am reassured by it. I think that it will at least bring people some solace that this was not something that was released to the world with some ill intention to cause damage, but it was just an unfortunate spillover event that, because of the way humans are connected, so there's this global connection between countries, between people, that allows for something that is more infectious than the flu to just take off. And because it's so novel, it was undetected for a while, which it allowed to spread everywhere.
Wow, so interesting. And any last thoughts? We have about 30 seconds left. Any last thoughts, Dr. Bento?
So I'm happy we had this conversation, because I think it's very important.
Me too. Thanks.
To understand the origins, right? So in order for us to move forward and continue with our plan to not only mitigate but suppress transmission, not just in the US, but everywhere, understanding the origins of a virus allows us to understand many particularities of transmission. So this is going to be major to have finally a certainty that many of us in the community already knew, but now everybody hopefully will start understanding this. But I think most importantly, the public, us, all of us, should now focus on hopefully getting our vaccination as soon as possible, because it's not so easy in certain communities. We're getting there, but also continue practicing social distancing and all of the other protecting measures to protect ourselves, but most importantly to protect our community.
Mm-hmm. Well, I mean, that's also a great point. I mean, I'm hearing that they're calling this the post-pandemic phase, and we are by no means there just yet. I don't know about you, but I'm going to be wearing my mask and social distancing for a while now.
I am working from home, and that's one of the reasons, because I am one of the fortunate ones that can still work from home.
Mm-hmm. Right. Well, Dr. Bento, thank you so much. This was such an interesting conversation. Thank you.
It was a pleasure. Thank you for having me.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.